Thank you, Dr. Shah, and thank you, Dr. Senthil, for having me. Are my slides visible and am I clearly audible?
Yes.
All right. So, hello everyone. I'm Tarjani. I work at LV Prasad Eye Institute as a faculty in the ophthalmic plastic surgery service. And I have this opportunity to talk to you on academic versus economic growth. So in my early career, I took the road less traveled, went towards the academic stream, and I'm going to sort of tilt the balance towards the academic side and give you an idea of what I think works well in both the situations. I will also highlight certain points related to both the mechanisms of growth, whether academic or economic, and bring out things in perspective of what are the similarities and differences in both these streams of growth, the timelines that sort of give you an achievable metric, the training that is required for both these streams, what are the catalysts for change in these scenarios, how collaborations and networking help you, and at the end, what next. So eventually I'll be summarizing all of these with you with 10 points that I'm going to list out in this presentation. So what exactly do we mean by academic growth? In ophthalmology, since we all belong to a common platform, let's talk about academic growth. So something that relates to ophthalmology would be possibly reaching the level of, say, for example, editor IJO or editorial board of one of the major peer-reviewed journals that are available internationally. So that is what you would give as a sort of a, picture of academic growth. And if you look at an institute that sort of garners this kind of culture, this is a picture from the website which will tell you about the several different things that happen when a person chooses an academic stream, such as publishing a book or certain named awards coming your way, editorial memberships coming your way, so on and so forth. Versus that, what is economic growth? So again, limiting ourselves to ophthalmology, when we are fortunate to be in a surgical field which can be very rewarding as far as economic growth is concerned. And if you typically look at a website of an institution which is centered on economic growth, you'd see something like this: a large number of patients seen, a large number of doctors on board, a large number of centers, and eventually a large earning that comes up along the way. So essentially, are these two different? To a certain extent, yes. But economic growth is always sort of, should be considered as a smaller part of your overall or achievements or of your overall academic growth, because a sound knowledge is extremely important no matter which field you want to keep yourself in. So keeping abreast with scientific knowledge cannot be underestimated at all. It is the fundamental resource which helps you garner technological change. And eventually, it's this technological change which is going to take you to a much higher economic growth. So let's look at certain similarities and differences between the two. So here on your left-hand side, you see the circle that typically involves an academic growth. So what is that essentially do you want to do? You want to contribute to science. How can you do that? You need to be very methodical in how and which way you want to contribute to science. You need to look beyond yourself and focus on getting a scientific question that you can answer by searching for gaps in literature. And you definitely need dedicated time. You cannot be bringing up a practice and simultaneously be doing very effective academics. You can do both to a certain extent, but both of them will be at a sort of a mediocre level. For this, again, you need a volume of patients. So it's not that, if you are in a setup where you do not have a volume and you're only pursuing academics, it's going to work out. You need that patient volume to test your hypothesis. And finally, a good scientific knowledge, all of which packaged together will help you advance your science and contribute to science at large. Versus this, when you look at an economic practice model, you essentially are centered on building your practice. Again, you need to be very methodical, but the focus is on yourself in the beginning. and on the patient that you want to treat. So that changes your focus a little bit in the economic model. You need to create a name or a brand value for yourself, which again requires dedicated time. You again need to build a volume of patients so that it takes you to a higher economic height. You need to have multiple collaborations that will sort of, fast track your success, build and maintain that volume, which eventually will keep pooling into building your practice and your name. So they have many similarities, so to speak, but there are certain differences. So let's look briefly at the differences. In a research or an academic practice, you will have to look beyond yourself. Probably your name might not be as prominent as the institute you work for or the research that you have put forward. Now, this is two ways. If you have done real good quality research, eventually your name will also get recognition, but it is probably not seen in one of the very glamorous roles in ophthalmology, so to say. Your basic ethos changes where you're actually searching for gaps in literature, and you're filling that with sound scientific knowledge to eventually advance science. Versus that, if you look at an economic model, the focus is very much on yourself, your practice, and your patient. So it's you-centered sort of a thing, with your patient in that circle. It's also, you're trying to create a brand name there for yourself, and you're not looking specifically at literature. You will have to put in a little bit of frugality in the beginning to make sure that you build a large volume practice which is successful and which gives you enormous economic returns. So let's look at the time taken to reach your destination for both of these sort of career paths. So if you look at, again, on your left-hand side, the academic module, then understanding what topic to start research on and developing a focus area itself takes time, and that's your initial 1 or 2 years of practice. And from there to absolutely be an established name in your niche area takes another 3 to 4 years. So your initial 5 years of practice have only gone in developing a research idea and working around it. And this is the time you start getting some amount of national acclaim as well, due to the presentations that you make on several national fora. International acclaim takes a little longer. You take about 7 to 10 years to reach that phase, and eventually to reach the stage of starting to receive awards, honors, and recognition within international and national scientific bodies is around 5 to 7 years. And then the next stage of receiving government and other NGO awards, say the Shanti Swarup Bhatnagar Award or something like that, takes about 15 years from the start of your career. Now, if you compare this to the economic model, then there building your setup takes you the initial 2 years, and then building your name takes about 5 years for you to be known in the local community. National acclaim, international acclaim, awards, honors, and government awards sort of are a little delayed if you are in the economic model versus the academic model. Having spoken about certain similarities, differences, and timelines, let's talk about the monetary gain. So obviously, since as the name goes, the economic model is the one where you are going to be actually achieving much more in terms of remuneration, or in terms of your bank balance at a much faster rate than the academic path. But then there are again points related to how much is your expectation, and how much of comparison do you make between the money you make and the name that you get. That plays a very important role and is a very individual thing as far as people are concerned. What is the background training needed for this? So for any academic growth, you need to have solid residency training supplemented with a good amount of subspecialty knowledge. Whether that is in the form of formal training or not remains debatable. You need to develop a niche area. You begin with diffuse research and then put yourself into very focused research to question the dogmas that are existent. Versus that, in economic growth, what you're going to do is, as far as training is concerned, is sort of look at being practice ready by the time you have finished your residency. possibly get in a little bit of fellowship training, national and international, because that has a brand value itself. Develop yourself into either a group practice or join a corporate or have your own solo practice. So that is the sort of training that you are looking at in both these models. I'll be taking both the presentations together. I'm reaching the end of the time. The second one is a little short, so I guess we'll just continue. Looking at catalysts for both these models. So what is it that works? One thing that works in the academic model is motivation. You have to be motivated to make yourself available for your research and to keep going despite not reaching the end of your logical research on many attempts. Certain things that help are joining societies like the young ophthalmology societies across the world, where again there are many ophthalmologists like-minded who want to get into academic models as well. Learn from peers who are into a similar path and relate and bond with them, and basically be at a place that has a culture for research, so that everyone around you seems to be doing the same thing, and that somehow tends to put you at ease. You need to build a close circle of friends who are like-minded and are going to be with you and are going to bring you up when you are down. And again, you need a lot of research ideas. And one thing that works is to learn from the questions that get asked by your fellows and residents. Those are excellent beginning points for research. When you look at catalysts for economic growth, there is a lot of networking that you need to do to develop your practice. You need to have several accreditations in place so that patients come to you. You have to have a work culture within your organization. You need to have a good website which people refer to and turn up to you. And you essentially need to become a local celebrity in your region so that you garner a large number of patients. Collaborating with bodies such as Rotary and Lions, as earlier mentioned, also helps. What are the other collaborations that can work? So you have several leadership development programs that can help you work on your research ideas, such as AIOS has one, and there are several other bodies that have their own leadership development programs that can help you. International short sabbaticals after passing your ICO or going for a 3-month fellowship sort of tends to work. It generates new ideas within you because you meet different people. Getting into actively reviewing manuscripts for a journal helps you build a scientific mind to eventually editorial boards, which will make you
continue. Go ahead.
Impactful collaboration with different people across the globe. And eventually you want this to go into translational research from the clinic to the bedside of the patient, so that you have made a difference in the management of a particular disorder. And you would also have to have certain amount of presence at national and international meetings to sort of continuously upgrade your scientific knowledge. When you look at the economic stream, you need to become a leader at the local level. It can be via various means and ways that have already been highlighted earlier. Electronic content release is one very powerful model these days, such as in the work from home culture. If you made a short video on how to avoid computer vision syndrome, it becomes a huge hit and can become viral and can help garner a lot of patients towards your organization. You need to bond with insurance agencies and TPAs to get in more number of patients, and also try to get into certain governmental schemes, corporate checkups. Opticals and pharmacy become a large source of revenue generation for nearly anybody who's in practice. And again, in this model also, since you want to become a local, regional, national hero, you need to be present at national and international meetings. And the last slide on what next. So I purposefully put this as just a picture. There are several roads that you can take. These roads also intersect at multiple places. It's not that once you've gone into one stream, you cannot go into another stream. Things can always change. Your career path can always change. From a research-centered practice, you might want to get into some roles of leadership over a period of time, and vice versa. So these are things that will keep evolving as you go ahead. Thank you so much for your time. And I'll, in a view of time, move on straight to the next topic, which was on work-life balance. I have a few slides where I'm just going to give an introduction, and then a couple of questions that I'm going to ask all the panelists listed out here. So unlike a balance, this is actually a very close network which is linked to multiple things in your life, your career, your family, and everything sort of tends to come at the same time, for men as well as for women, and there is a minority of women here today, but nonetheless, where things become very difficult and challenging because your career path and your reproductive path are nearly running parallel. So what is the most important thing? Well, the most important thing is managing your time well, so that you have a great work-life balance. And these are 5 things that in my mind sort of appeal to me when I think of work-life balance. The first is to examine your own situation. Not everybody will be in the same sort of situation. The amount of house help you might have might vary. The sort of families you are in might vary. So examine what is your situation, and then what are the most important values that to you and how you want to spend your time. Based on that, try to get everything else converge onto your values and what works for you most importantly. The second thing that you require is to also manage other people's expectations. You are in a social circle, you're in a family where many people would have expectations from you, and it is important to be a part of their expectations and try and manage them to the best of your capacity. I cannot undermine the effect of managing your health, because this is one of the most important things, not only in the chemicals that are released in your brain when you're healthy, but regular exercising, taking your time off, making sure that you are doing things that make you happy, such as meditation or say a trek on a mountain or whatever it might be. This goes a long way in maintaining sanity. At certain times you need to learn how to say no, whether it is for your work or whether it is for your family, and that clarity in mind should be there without any conflicts, so that you are not in a dilemma and you're not worrying about a problem once the problem has been tackled. Also, you need to at some point of time invest time in some amount of fun activities that keep you going. So with this, if Dr. Debashish could take up this question. So this question, sir, for you is, how do you manage your calendar and schedule, being at a place like Disha where you would be very, very busy in managing the large amount of HR that you mentioned? How do you manage your calendar to make sure that you have a good work-life balance?
See, I work 9 hours a day. I can't work more than that. So essentially, I have 4 clinical days and 2 administrative days. And 1 day is for me and my family. So essentially, that's how I work. Of course, I don't look after HR. Yogesh gave me the topic, so I had to talk. But essentially, I'm more of in a strategic role. So essentially, in Disha, it is a big organization. We see 12 lakh paid patients and do about more than 1 lakh of surgeries. But then over the years, this has happened. So it is compartmentalized, and I think things are in position and they keep on working.
Right. So those were some excellent tips. If I could just reiterate, compartmentalizing, dedicating days for work and administration as well as for one's own self sort of go a long way in keeping things on track. Thank you for that, sir. So this one is for Dr. Senthil. And the question I have for you, sir, is that many times we say that good is the enemy for perfect. And we try to achieve perfectionism in a lot of things that we tend to do. And that takes away. Okay, if Dr. Senthil is not here, probably Dr.
I'm here. I will take
okay.
the
Okay.
Yeah. So how do you go about that? Perfectionism takes a lot of your time, and many times we just refuse to settle for something that is good enough. So what would be your take on this?
I think in India, the biggest problem is achieving this perfectionism, because most of the time the employees are not tuned towards doing that 100% clear work. Let's say you go to the Europe, so you see a wall which is very cleanly plastered, but in India you don't see that perfectionism. So when you want to achieve that, So first thing is to understand the reality. So things may not be as perfect as you actually wish to. So maybe you should settle for, if you're aiming 100, maybe even if you get 98, you should be okay. The second way is basically you do things on your own and train those employees to do that. I think that is the other way. Otherwise, they don't understand what is your expectation, because it's important to make them understand what is the expectation we have. And maybe there are situations where you have to do that yourself and then show them so that they do that. That's the only way.
Right. Thank you very much, Dr.
We
Senthil.
have 2 more minutes.
Yes. So just quickly going through Dr. Gaurav Shah, if you could tell us how you decide on unplugging from the normal chores of the day and to break free, your inputs on this.
For me, meditation and spirituality has been a big help, and I regularly plan my times off from the clinic, where I can go and be undisturbed and be with my own thoughts, or let's say silence my thoughts actually, so that I can reconnect with my own self, and that has helped me a lot.
Perfect. Thank you so much, Dr. Gaurav Shah. And probably the last question for Dr. Yogeshan, how you plan on having family balance. So in your earlier years, when you had 2 young children, how did you manage it?
I think that time was a quite difficult time, and I must say and admit that it quite a lot depends upon your spouse as well. Just to brief you, I had almost about 20 attachments at a given point of time. I was attending 20 different hospitals within a week's time. And at that point of time, you need to have a spouse also. But at the end of it, you also have to select a time out for the family, and don't consider only those 20 attachments which you have. Consider 21st attachment as well. And I think in a long run, that always pays, because you also become a fresh person spending a quality time with your family. So you always need to, and that is what I did, in fact, actually, that even if I had to go out, I would take my family also along with me, so that while working also, I do find some time, whatever time is available to me. And that is the way you can make best use of your quality time also. So I think because time is short, we will possibly end our this thing here. We will not have any further question answers because it's already 2:15, and that was the time which was allotted to us. Thank you very much, Dr. Senthil, Dr. Debashish ji, Dr. Gaurav Shah, and Dr. Tarjani. All of you did extremely well, and I'm sure this instruction course must have benefited not only the people who are going to start with their practice, but also those who are already in the practice, and especially those who where both husband and wife are in the same profession, and both of them have to spend a lot of time with their academic as well as the clinical work, how to make best use of it and devote certain time to their family also. We have tried to cover a large number of points in this instruction course. Thank you once again, everyone. And I take this opportunity to thank All India Ophthalmological Society, Secretary Dr. Namrata, outgoing President Dr. Maipal, and incoming President Dr. B.K. Nayak. Thank you all. Thanks a lot.
Thank you, Yogesh. Thank you.